Well, I think already there's a large amount of strategies that have been put forward to help people during the COVID pandemic. I mean, people have talked about the importance of structure in the day, sleep, healthy eating, connectedness, and various people's strategies are sort of slightly different. The other strategy, which I think is important, is people sort of assessing their own situation, because what works for one person is not necessarily going to work for another. So the phrase I've heard is, we're all in the same storm, but we're in different boats. So one boat's going to require a different approach from another boat. I think an important message at a time like this, especially when the images that we're getting from overseas are so graphic and so horrific that they seem on face value unmanageable, is that our experience, our research indicates clearly that human beings, even when faced with major traumas, mostly cope. It's not true that if a terrible thing happens to you, you're going to develop a mental disorder or somehow break to pieces. In fact, the vast majority of people, they'll experience some sort of distress, difficulty, worry, sleep disturbance, sense of, impending uncertainty, but most people actually find a way through. And this is the sort of foundation concept of resilience. Human beings are resilient, and the kind of strategies we've talked about earlier, and people can, again, look up themselves, bolster that resilience. My advice is that most of the time, that strategy that you work out yourself with your family is probably going to be better than any protocol or any professional kind of guideline that you come across.